Hi, Randy Magas, Doctor of Chiropractic. I want to talk to you about your ribs. And so most people know that chiropractors adjust the neck, the upper back, the lower back. You know, we adjust babies and women and children, but we also adjust ribs. And so I'm going to tell you a little story of when I first started out, and then I'm going to tell you what I can do to help. So if you have certain pains in your chest or in your back area, chiropractic can help. So I had first gotten out of school, and probably my first week or two into practice, I had a lady call me on the phone. And she said, "Hey, I have been to my medical doctor, and I'm having pain in my gallbladder area. And they took x rays, they did gallbladder studies, they did everything." And she said, um, "They tell me there's nothing wrong with me. So they can't take my gallbladder out, they can't do anything with me." And she said, "I really think it's my ribs." And at that point, I was early in my career and my education. I'm going like, well, I'm not real sure. So I had her come in, and she said, "Well, this is where I'm feeling the pain." She goes, "I know my ribs are out, and I think that's what's causing the pain." And she didn't have a healthcare degree, but she felt that that's what it was. So I was honest with her. I said, "I'm not sure what's going to happen here, but I said, let's give it a try." So I do manual adjusting, and I also use the activator instrument, which when you push on this, it's spring loaded, and it pushes the bones. And so what I did was I came along here in the front of her chest, and I found out where it was a little inflamed there and where it was really tender, and I adjusted that area for her. I then also adjusted the back and the ribs when they came off of in the back area. And I gave her an appointment in 2 days. She came back in and she said, "I think I'm about 50% better." And I said, "Okay." So I went and worked through it, adjusted everything again, and set up her next appointment for the next week. And she called and said, "Hey, I'm not going to come in. I feel great." And so that was my first real big introduction to working with people with rib pain. So I do have people that come in and they'll have pain right up in the front with the ribs. So you have this big bone that comes down the center, and then the rib attaches right there. And sometimes they get out either forward or backward. A common thing with the front one is someone just fell, or they'll say, "Oh, I've had a really bad cold and I've been coughing really bad." And that tends to throw them out. I adjust them, and they get significantly better. The other place that people come in with their ribs are out, it's out in the back. And our ribs don't come straight across like this. They actually come down at an angle from the back. So most people will say, "Well, it hurts here in my back," and then it comes down towards the front. Because between the ribs there are nerves running through there. And so that's a really good indication that that's the problem. And then the other thing they tell me is it usually feels like someone's stabbing a knife in there. So it's really sharp pain. So I have them lie face down, and I can either push on them manually to put them into place, or I can use that activator instrument. The other way I've seen really cool results with rib issues is with athletes. So I've had athletes come in. I even had one that said they thought that she had asthma because she had difficulty breathing. And but they went to the medical doctor and everything was fine. Had the patient come in, did an assessment, adjusted the ribs in the back, and then I actually took my hands and I worked out between the ribs to loosen those muscles up. And then I showed her how to just work the ones up front on her own, and she worked those out on her own. And she was supposed to again come in for her third treatment, and her mom called and said she's doing just fine. Kind of a fun aside by that was I told the girl she had a basketball game that night, and I asked her how many points she usually makes, and she said, "Well, I usually make 4 to 6." And I said, "Well, if you make more than 10, and if you're feeling that much better, you have to call me and let me know." The next day, I hadn't heard back, so I called the mom, and she said, "Well, she only scored 9 baskets." So I said, "Well, that's fair. I guess she didn't do 10 or more." So, but her mom related to me how much better she felt, how much better she could breathe. So sometimes things seem pretty simple, but it can make a huge difference. And if you're having that nagging pain in your back or up in the front, realize that there's care out there for you. You don't have to put up with that pain. You can come and get help and live the life that you deserve.